You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes, and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. And in this podcast, I like to share my 30 plus years of experience as a dentist, my holistic insights, which is basically talking about the links between your dental health and your overall body health, and how dentistry, dental infections, and dental work can impact on your health and well-being, as well as many other topics that are designed to help keep you healthy and fit for life. If you'd like to know more, hop on over to holisticdentistry.au or evolvedental.com.au, which is my dental practice website. Today, I want to talk to you about the tales your tongue, teeth, and mouth can tell us as your dentist, and you, if you bother to have a look, about potential health issues that are going on with the rest of your body. So let's get to it. Let's get in the zone. I'll begin by talking about the tongue and the tales the tongue can tell about your health. So, what your tongue tells us about your health, what are we looking for? I mean, like if your tongue could talk, like literally talk to you, what tales would it tell you about what's going on with your health? Now, it wouldn't come as a surprise if I told you that a trip to the dentist involved getting your teeth checked. Yeah, and we're going to look at your gums. But do you know that we look in your mouth, we're also checking your cheeks, your lips, and your tongue. And we're looking for signs of not only dental disease, but indicators that there might be other things going on in your body. So, what role does your tongue play? Well, it does more than just taste things for you. Your tongue is essential for speech and swallowing, and it also helps keep your teeth clean too. It produces saliva, which cleans away harmful bacteria that would otherwise spread in your mouth. But did you realize that your tongue actually tells tales about the state of your health? Now, as a holistic dentist, I'm particularly interested in the condition of your tongue because it can speak volumes about your health and well-being, your nutritional status, and even your stress levels. So, how can I tell if you're healthy? By looking at your tongue. And how can you tell if you're healthy by looking at your own tongue? Your tongue's color, the texture of it, and the moisture levels can provide information on how your body is feeling. So, if you're feeling unwell or you're just plain curious, you can go stick out your tongue and take a look in the mirror and find out what tales your tongue has to tell about you. But first of all, you need to know what to look for. A healthy tongue should be pink in color. It should be slightly moist. It should be smooth with no really noticeable bumps or spots. And it should be layered with visible taste buds, which are the little dotty things that you can see. So let's talk about the tongue color. Now, the color of your tongue can reflect your nutritional status and the health of your internal organs, as well as the level of blood circulation in your body. So, a pale tongue, this can indicate that your blood is lacking in hemoglobin, which means that you can be anemic and low in iron, especially if the tongue is extremely smooth. You might also feel a bit tired and lethargic. Now, you need to ensure to counter that you're eating foods rich in iron and taking vitamin C so that you can actually absorb that iron and get it where it needs to go. Well, a red tongue. Now, a bright red tongue suggests your tongue is inflamed, and this can be caused by nutritional deficiencies like iron and also your B vitamins, particularly folic acid, vitamin B12, or vitamin B3. Now, what if your tongue looks purple or sort of dark bluish? That can indicate high cholesterol levels, low oxygenation of the blood, poor circulation that results in stagnant blood in your tongue. This is often a result of lifestyle, diet, and medications. And if your tongue is regularly purple in appearance, then I would urge you to consult your physician or your doctor and get things checked out. Now, what if your tongue looks white? Now, there's some reasons for this. A white coating on your tongue can be a sign of dehydration. It can be caused by smoking or alcohol, which disrupts the oral microbiome, the bacteria that naturally live on your tongue. And a white coating can also be a sign of thrush or yeast infections. Now, if your tongue does look white and coated, that can be a sign of poor diet, toxicity within the body as well. So it's important to get to the bottom of why that tongue looks white. What if your tongue looks black? Yeah, some people's tongues look black or dark brown. A black coated tongue results from an overgrowth of bacteria and yeast. It's quite common after a course of antibiotics. Again, the oral microbiome's been disturbed. And it's usually a harmless condition that resolves by brushing and cleaning and tongue scraping twice a day. Rinse your mouth with diluted hydrogen peroxide. That can also help remove the discoloration. And oral probiotics and probiotics for your gut function can also be beneficial to addressing this problem and reintroducing good bacteria into your mouth, which suppress the yeasts and the nasties. Well, what about the texture of your tongue? Now, your tongue should be smooth in appearance with visible taste buds. If you don't know what they are, then hop on over to your internet browser and just search for tongue. What does a normal tongue look like? And you'll get some images. Texture changes, again, can be due to nutritional deficiencies, allergies, infection, or health issues. So if you've got raised red spots on your tongue, these spots are due to broken veins and capillaries in the tongue. And I would suggest taking bioflavonoids and vitamin C to help strengthen those capillaries. Look, if you've got that going on your tongue, you've probably got like those little micro spider vein things on legs and other areas of your body. So just good to get that checked. Can be a sign of liver dysfunction as well. Ulcers, now these can be quite painful. They'll usually last between 10 or 14 days. Um, and they can appear for apparently no reason. They can be triggered by stress, fatigue, or vitamin deficiencies, particularly your vitamin Bs again. It can be triggered by trauma, sharp edges on fillings, clenching and grinding where your tongue gets caught between your teeth. If it also lasts longer for 2 weeks, now this is really important, or it's bleeding, you must visit your dentist immediately because this can be a sign of something more serious like mouth cancer. So, with ulcers, if you're getting regular ulcers, then I would look at increasing your B vitamins, reducing stress levels, upping your zinc. If you've got an ulcer, then you can use hot, salty water to rinse around with to help it heal. And if it does last longer for 2 weeks or there's bleeding associated with that ulcer, then please take that seriously and get it checked out by a dentist. What if your tongue looks hairy? Now, if the papillae, which are the small little bumps that cover the surface of your tongue, become enlarged and overgrown, it can make the tongue look hairy or furry. Now, this isn't something that is a bad thing, it's not a health issue as such, and it is actually considered quite normal for some individuals, although it looks a little bit strange. Now, there's a condition called geographic tongue, where your tongue looks like it's got a map on it, and this has areas of smooth and bright red patches on top of the tongue. The patches can change in size and location and have a map like appearance, which is why we call it geographic tongue. Occasionally, this can be associated with soreness and burning. And this condition is harmless and usually resolves on its own in a few months. It can be triggered by stress, hormonal changes, or allergies. Fissured tongue. This again is another harmless condition in which deep grooves form on the tongue's surface. In fact, a fissured tongue is an inherited trait and it normally occurs in 10% of the population. Just like your fingerprints and your teeth, the patterns and the shapes of your teeth are unique to you. Your tongue is also like your own fingerprint, and no two tongues are the same. What if your tongue is swollen or puffy? Now, this can be caused by allergies, medications, infection. It can, affect the tongue, mouth, or gums. And, because the whole mouth is inflamed or reactive, but it can also be due to vitamin B12 deficiency. Now, what if your tongue is enlarged or swollen? Now, this can be caused by a number of disorders, things like streptococcus, a strep infection, leukemia, cancer, hypothyroidism, which is underactive thyroid. It might also be due to a hangover, you've had too much alcohol, an allergic reaction to a food or medication. If your tongue is swollen and it doesn't go very quickly, then you need to check with your doctor or your dentist and really make sure there's nothing else going on there. Now, a scalloped tongue, which means it's got like indentations around the sides, which will often match the shape and position of your teeth. Now, this is a sign of clenching and grinding. It can also be a sign of sleep apnea, where your tongue is pushing and pressing against your teeth as those muscles all chew and grind and slide around. Now, vitamins and minerals like magnesium and B vitamins, vitamin D, they can be of help with conditions like clenching and grinding. If we consider there might be sleep apnea, we need a sleep study. You might need a CPAP or an oral appliance. And if you do have scalloped tongue, then we can make an occlusal splint or a night guard or a sleep apnea appliance that gets made by your dentist. And what if you've got a coated tongue? Now, a healthy tongue should have like a little film on it, a thin, transparent coating, and that coating is a layer of saliva and a little bit of mucus that helps act like anti-evaporation, and that helps to keep your tongue healthy. So changes in that coating can indicate an acute illness, such as a cold or a virus, and digestive issues. Now, if the coating is yellow, that's a result of a bacterial or fungal infection. If it's furry, so there can be like a thick coating, that can be an infection, oral thrush, dehydration, sign that your body's toxic, and this can impair your taste and cause bad breath. Now, what are the best ways to look after your tongue and keep it healthy? To keep your tongue clean and healthy, I recommend brushing your teeth and using a tongue scraper at least twice a day. Tongue scrapers are really inexpensive and they're very easy to use. It takes 10 to 15 seconds today to do. And so you stick your tongue out and you slide the scraper gently over the tongue, working from one side, down the middle, then the other side. And you repeat 3 or 4 times so that you've covered the entire surface, and voila, you've got one nice clean tongue. Super easy. So, how can you support your tongue health? Are there things that you can do? Excuse me one second. Are there things that you can eat? Are there nutrients and so forth? Well, it's pretty clear that nutritional deficiencies are often related to the appearance and the health of your tongue. So it would make sense that there are some nutrients that I advise that are going to help promote good oral health and well-being. So let's have a look at those now. B vitamins. Each individual B vitamin has its own specific role to keep the body healthy. Deficiencies in B6 or B12 can lead to a swollen, sore tongue, along with teeth indentations and fissures on the surface of the tongue. Iron and iron deficiency can cause swelling of the tongue and painful sores in the mouth. It can make your tongue look pale and very smooth and flat as well. Vitamin C, this helps keep the capillaries and the mouth tissue strong. Bleeding gums, for example, are often a result of lack of vitamin C and zinc. Vitamin C helps the body fight off infections and yeasts such as candida that cause oral thrush. Also going to look at calcium and vitamin D. The jaw and teeth have a high calcium content, but calcium deficiency can reduce resistance to infections, and therefore you can get problems with your tongue, your gums, and also tooth decay. Vitamin D has a positive impact on oral health as it does on our general health, and recent studies indicate the that taking vitamin D is actually preventative for tooth decay and can reduce your risk of tooth decay by up to 50%. Now, if you want to have a healthy mouth, then you need to love your tongue. You need to feed it great nutrient dense foods. Keep well hydrated, limit alcohol and smoking, limit things like coffee, which also dehydrate you and are acidic, lower your stress levels, and keep your tongue clean. I also would encourage you to have a look at your tongue on a regular basis because it's going to tell you pretty quickly if there's something going wrong with your health. So we've focused on your tongue and how we use the tongue to let us know what's going on. But there are also things that we can spot as your dentist that can give us some indications of other health issues going on. So, your eyes might be the window to your soul, to be a bit cliche, but your teeth and gums can say a mouthful about your physical health because there are some health problems that your dentist can spot during your checkup. So, when we say open wide, we are examining your mouth for clues to your health as well as signs for dental disease, particularly as holistic dentists. But many people are reluctant to visit the dentist. They've got phobias, they're nervous, they don't see it as that important, and they put things off. But guys, having a regular checkup could be a lifesaver. We have had medical training. We are versed in oral pathology. We do study medicine and surgery. We study pathology, as I've said. We study pharmacology. We study branches called oral medicine. There are lots of things that we can detect as dentists that can be early signs of major illnesses and disease, often before you even have a clue or feel unwell. And I think dentists would do well to educate patients that our work goes well beyond checking on the health of your teeth, that we are part of your healthcare partnership, and there are things that we should be talking to our patients about a lot more. So as a holistic dentist, I'm always explaining to people how the condition of their teeth, mouth, and gums tells me about the overall state of their body. And we need to teach and educate people that there is more to a dental visit than just spotting decay and cleaning your teeth. During your comprehensive dental exam, I am always on the lookout for symptoms and signs that might indicate illnesses that are non dental in origin. So, come on, you might be going, what does a dentist really know about my health? Well, we know a lot. During your routine dental check, we can uncover important clues about your overall health. So, like if your tooth example is worn down, if your tooth enamel, for example, getting my words switched around, is worn down, that can be a sign that you're suffering from stress. It can be a sign that you're deficient in vitamin D. It can be a sign that you're deficient in magnesium or your B vitamins, and that you're grinding and clenching your teeth at night. Swollen and receding gums. Now, that can be an early sign of diabetes. You've got sores in your mouth that don't heal, that can indicate oral cancer. It can indicate other conditions as well. Now, your dentist might be the first to notice these symptoms and may be able to spot health problems for you before you know you have them. Yes, we're concerned about saving your teeth, but we're also concerned about looking after you, and we're looking at how your oral health fits into your overall well-being. So I'm going to talk about, as part two in this episode, the common conditions that we're looking out for that can affect your oral health. So what are the 12 health problems that we as your dentist can spot? Well, there's diabetes. People with type 1 and type 2 diabetes are much more likely to develop gum disease because they have a decreased ability to fight bacterial infections, including those that occur in the mouth. In addition, serious gum disease can make it more difficult for people with diabetes to actually control their blood sugar levels, and you get in this kind of vicious cycle. So when I see a patient with symptoms like frequent gum abscesses, swelling, a lot of bone loss in a short amount of time, gum disease that doesn't respond to normal treatment, these can be a sign of diabetes. And over the years, I've had several patients who I identified as diabetic and they didn't even know it. Now, if I suspect that you have undiagnosed diabetes, I will advise you go to your doctor for testing. I can also tell if you're a diabetic and your blood sugar is not well controlled because gum disease becomes more difficult to treat. Now, if you have a history of diabetes, then I will always recommend more frequent exams and hygiene visits so that we can ensure we keep any gum disease issues at bay and under control. Oral cancer. Now, the first sign of oral cancer is often a small red or white spot or sore in the mouth. It can appear on your lips, your gums, your tongue, your cheek lining, or in other parts of your mouth. Now, often you don't notice this because it starts as a small spot, can be at the back of the mouth or under the tongue, and you don't have any symptoms. Dentists should screen for oral cancer as part of your routine dental exam. It takes like 90 seconds. By scheduling regular checkups, you can increase the chances that any potentially cancerous or precancerous lesions will be caught early and successfully treated. If you smoke or you regularly consume alcohol, you are at higher risk for developing oral cancer. So I recommend that you make sure you have regular and frequent visits to the dentist if this is you. Be sure to also tell your dentist if you notice symptoms like a sore in your mouth that doesn't heal, a lump, any pain or numbness anywhere in your mouth, in your lips, or on your tongue. So I've touched on this stress. Your teeth may be worn down or chipped. You've been unconsciously during your sleep, clenching and grinding them. This grinding, known as bruxism, will eventually cause bone loss around your teeth that your dentist can detect on x-rays. Clenching and grinding can chip, crack, and even split teeth and can cause significant and sometimes irreparable damage. You can end up with facial pains, neck pain, shoulder pain, headaches. All these can be signs of clenching and grinding. Bruxism is not caused by stress, but it's worsened by stress. It can also occur because your top and bottom teeth aren't aligned properly, and it can be a sign of disorders like sleep apnea. Now, you may or may not be aware that you clench or grind your teeth, but your dentist can definitely spot the signs. To prevent damage to your teeth and keep them apart so your jaw muscles can relax, we can fit you with a custom-made night guard and occlusal splint that you wear while you sleep. Now, this one isn't kind of one that we can spot, but we might be able to give a heads up and just help prevent some problems on this one, because dental diseases can be linked to premature and low weight births. Now, pregnant women with serious gum disease called periodontitis are more likely to deliver a premature baby of low birth weight. because the bacteria in the mouth of a woman with gum disease can trigger an increase in a chemical compound called prostaglandin and other harmful inflammatory molecules. These chemicals can induce early labor and impair growth of the fetus. Now, women who are pregnant or thinking about getting pregnant should get a dental exam and, if necessary, treatment for gum disease as early as they can. If you want a healthy and predictable pregnancy, it makes sense to take care of your gum health as early as possible. On the flip side of this, because of the changes in hormones during pregnancy, we can often spot the signs of that before it's obvious that the woman is pregnant. So gums can become more inflamed, more swollen, more puffy, and bleed much more easily because of the changes in the hormones and the immune system when a woman is pregnant. Heart disease. Now, gum disease is linked to the increased risk of heart attacks and strokes. Excuse me. So you should tell your dentist if you've got cardiovascular disease or you have a family history of these conditions. But there's been a lot of research investigating the links between cardiovascular disease and gum disease, and the link is that the inflammation in the mouth increases inflammation in other parts of the body, including the arteries, and this plays a major role in heart attacks or strokes. But also the plaque bacteria migrate into your gums and your bloodstream, and they then go and lodge in your arteries where they form plaque adhesions and thicken and the arteries and make the arteries more stiff and therefore block the arteries and make you more at risk of heart attack. So treating gum disease and reducing the inflammation in your mouth lowers your risk of stroke or heart attack. One of the things that I also look for here is the blood supply or perfusion of the tongue, lips, and gums. There can be low oxygenation in somebody who is at risk of a heart attack. We can see things like pale gums, pale lips, and tongue. And the tongue can often look a little bit blue, as I've mentioned, and those things can be signs and indications of heart disease. And so these will be things I will touch upon with my patients. Now, cancer, I know I've talked about oral cancer, but if cancer is in the bones of the mouth, it's spread from somewhere else, then we can spot these swellings, we can spot these changes by looking and on x-rays. We can feel around to see if the salivary glands are infected, if there's swollen cheeks, and tonsils, that can be an indicator. We also check for any swollen lymph glands in the head and neck region. And if we do spot that, then we will discuss it and we will recommend a visit to the doctor to get that checked out as soon as possible. One of the other things we can detect is leukemia. Or the signs of leukemia. Let me be very specific so nobody misinterprets what I'm saying. Swollen and enlarged gums, bleeding gums, and ulceration of the mouth are all early indicators of this life-threatening condition and can be easily detected by the dentist. So I've had patients in the past where we've been looking at their gum health, we've been treating them for gum disease, things just don't add up. With discussion and conversation, taking a bit of a lifestyle and life history, we can sort of put two and two together. And then I encourage these patients to go get blood tests and get their white blood cell count checked out. And often, unfortunately, it does show that there is leukemia, but thankfully we have picked it up and we've been able to help that patient to get the treatment that they need. Another thing we can spot is osteoporosis. You don't just get, osteoporosis in the bones in your body, you get them in your head and your jaw bones as well. And we can often see a decrease in bone dentistry in the bones that hold the teeth in, and we can spot this on dental x-rays. And again, then we raise this with our patients and get them to have the relevant tests. Hodgkin's Hodgkin's disease. This is a sometimes fatal disease of the lymphatic system. It shows up as swollen lymph nodes that can be detected in the mouth. It can be detected in the neck and the head and neck region as well. Addison's disease. This is a condition that affects the adrenal glands. It will result in weight loss, fatigue, and lowered resistance to infection. And again, we can pick this up from changes in the pigmentation of the oral tissues and gums and get these people off to their doctor to get tests. HIV. Indicators in the mouth include ulcers, enlarged tonsils, thrush infections, growths, what they call Kaposi sarcomas, which are like a big purple or brown lesion, and also severe gum disease. We can detect blood conditions and more, so we can pick up things like anemia, vitamin B deficiency, oral thrush, fungal infections, and even autoimmune conditions, as I've spoke about. We look at your tongue and that can tell us a lot. And these are just some of the health conditions that I'm aware of and I look out for when I'm seeing my patients. Now, hopefully from this list and the things that I've discussed in today's episode of the Dental Zone, you get to see how important regular visits are for your dentist, not only for your oral health, but for your general well-being as too. Because as dentists, we can actually spot health problems by looking in your mouth. So the next time you're thinking about putting off that dental checkup, or you've got a loved one, a friend, or a work colleague who you know doesn't go to the dentist very often and you care about them, then you should, if you're putting it off, think about visiting your dentist and encourage your friends, loved ones, and colleagues to do the same, because it could not only save your teeth, it could save your life. So thank you very much for joining me. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. If you'd like to call us for a comprehensive dental exam and health screening, you live in the local Brisbane area or you travel because you're here in Australia, then 0737201811 is our number. If you want to know more about holistic dentistry and things that go on in your mouth, then evolvedental.com.au or holisticdentistry.au. And until next time, thank you so much for joining me. Thank you for being part of this movement. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.